Hi everyone. So Ollie and I are just home here this evening from work.
Hello.
There's Ollie. And we were just chatting. Ollie had a patient today with tennis elbow and we were just talking about tennis elbow and we thought why not record a bit of it, and then if anybody at home has tennis elbow or knows somebody that has tennis elbow, they might find the information helpful. So we're just going to talk you through what it is, how we diagnose it, but more importantly what we can do to help it and what you can do at home to help it as well. Ollie's going to help out in a second. Right now he's checking on the dinner. Chicken curry for dinner. Okay, so what is tennis elbow? Most patients that come in with tennis elbow have pain on the outside of their elbow. It can come up into the arm a little bit. And it really classically is an overuse injury. So Ollie's patient that came in with tennis elbow was struggling with it because they were doing lots of driving. The last patient I had with tennis elbow was clipping sheep. So again, it was a gripping activity. So usually it's caused by some kind of repetitive movement of the wrist and not actually the elbow, because the muscles that are on the outside of that elbow actually are responsible for wrist movement. If I try and take this up a little bit and show you, so I don't know if that'll come up there, but that's me gripping and moving my wrist, and it's this group of muscles here that causes the problem. So patients who are maybe typing a lot on their computer, where they're using their fingers or their wrist. Other examples are, there are sports related ones, but things like using screwdrivers or hammers, repetitive gripping movements. Golfing sometimes can cause it.
That's on the inside though. That's me.
Yeah, can switch to the inside. But you know, sometimes the gripping from golf can cause it as well. But it's usually something repetitive like that. Another big one actually is when people take on painting tasks, especially when the weather's good and some people are painting the outside of their houses now, and the repetitive movement of the brush or gripping the roller overuses this muscle group. So what actually happens? Well, under the microscope, where the muscles attached into the bone on the outside, there's tiny little micro tears. And sometimes those tears are there, but it's the repetitive movement that then aggravates it. And symptom-wise, you'll get pain on the outside of the elbow. It can be very sore to touch, and it can go down into the arm. But pain is the predominant factor. And people report they have pain when they're carrying weight, maybe carrying shopping bags, when they go to turn the key in the car, or when they're doing any gripping movement. And clinically, our tests for it are pretty simple. So pain along the outside of that elbow, we resist their wrist extension like that, it'll usually be painful, or simply resisting middle finger extension, so lifting the middle finger up, pushing down, and if it's painful, it's usually a positive test for tennis elbow. Now in clinic we do a few different things to rule out other causes of pain in the elbow, but usually when those tests are positive it indicates that there's a tennis elbow going on. So what do we do to treat it? Well, the first and most important thing is to stop the aggravating activity, and that can be tricky. So we try and get patients to break up the task if they can, to avoid the task if possible for a short period of time, to really give those muscle groups a chance to rest. The other thing that we can do is sometimes, and the evidence is a bit dodgy on this, but sometimes we find it helpful to splint. Now, there's lots of straps available to offload at the elbow, but what I find most effective, and Ollie, I don't know what you think of this, but sometimes I actually splint at the wrist. So I use a wrist splint short term to offload the muscles to try and stop aggravating, and I've used that successfully a few times in clinic. What do you think?
Yeah, it just helps. It helps to offload. And basically stop that movement with the hand going back and forth. So yeah, I would use it. I don't always use it, but some people that are just
the really irritable ones, yeah,
just can't rest and they have to work.
So maybe if somebody comes back after their first session, it hasn't calmed down, then I would go to that extreme to try and stop them aggravating at the elbow. You can use ice. Now, ice is really just sort of short-term relief of pain over the outside of the arm, and we usually say, for maybe 20 minutes 3 times a day, particularly if it's really aching. Ice can just give that short-term relief to calm it down. Make sure you wrap your ice in a cold pack, or sometimes what I find helpful is to fill a polystyrene cup, put it into the freezer, peel away the top layer and just rotate the ice along the outside of the elbow, and sometimes we find relief from that. But really for us, the biggest thing that we use is exercise to try and get the tendon to regenerate and to calm down. And we usually start with something called isometric exercises, and that's where we don't actually move the arm at all. So maybe we'll just try and show you here. I don't know how that's going to come around. Hopefully you can see there. So what we're doing here, you see that okay?
Yeah.
Yeah. So isometric exercises is when we're not moving the elbow or the wrist. So we would start with no weight at all, just using, like Ollie is here, using a towel. You grip as hard as you feel you can. Now, you can feel some pain. Well, I normally say 0 to 10, 10 being the worst pain imaginable. You're allowed pain 3 out of 4. So you might have to adjust how much you're gripping.
How long would you grip for?
I normally say about 5 seconds. Roundabout, depending on pain. If the pain starts to go up, it'll alter how long I tell someone to grip. So 5 seconds if you can tolerate it. If you can go up to 10 seconds and the pain doesn't go up, then 10 seconds is fine, and then relax off. Now, in the literature, how many of these do we do? You know, there's no set guidance, but we usually try and say about 20 if it's comfortable, going to 30 if you can tolerate it, and just once a day is fine. Once it's comfortable in that position, I then normally get the patient to extend the elbow. So now just extending the arm like that puts a bit more load on the muscle, and then repeat the same thing. So once it's comfortable with the arm resting on the table, you put the arm straight out and then repeat that isometric squeeze. Same reps. And again, you're altering how hard you're squeezing depending on your pain. Once that's comfortable, then we add weight. So you can do something like a half a kg, which would be, you know, a can of beans or peas. I would do the isometrics again. Yeah, with the weight. So you would start again with the weight on the edge of the table. And so now you've got weight in the arm, and do the same thing. Squeeze as hard as you can. And then relax. Once that's comfortable, straight arm. Now you've got more weight in the arm, and then you're squeezing as hard as you can, holding for 5 seconds, and then relaxing, trying to do 20 if you can tolerate it. Once that becomes comfortable, then I would start the movement. So back to the arm resting on the edge of the table, and then you want to keep the arm completely on the table.
The elbow in there.
There you got it. And you're going to just bring the weight down. The movement here is at the wrist, and then bringing it up as high as you can. Gently bring it down and then up. Now to start with, this might be barely any weight. You might be doing your towel again, or usually we start with half a kg or 400 grams, which is a can of beans, and then we progress the weight up as the patient can tolerate it. And again, it's going to be sore, slightly sore when you're doing it, and that's okay. You're looking for that 3 to 4 out of 10 pain, and this time you're trying to target towards the 10 reps by 3 sets if pain allows. So all the way down, keeping that forearm on the table, and then up as high as you can. Now once you can do 30 reps comfortably with your half kg, you then take the arm into the straight arm position. And again, we see that okay? And then repeat. The arm stays still, but you bring the wrist up and then down as far as it'll go. Coming up and down. And again, you want to be able to do that comfortably. 10 reps by 3 sets before you would consider upping the weight. So that's the basic start program that we would do with our patients. So just to recap, it's those isometric contractions with the towel. Always done. Yep. So start with the towel, gently squeezing with the arm rested, then up to 90 degrees, squeezing and relaxing, then your weight over the edge of the table, letting the wrist come down and back up, and then at 180. So that's how we would progress it once it gets comfortable. And the whole idea is that we're trying to strengthen that muscle group to regenerate and build its power, so then you can tolerate the activities that you're doing. Always banging in the background. Chips are nearly done.
Hungry.
Other things that we do use, we do sometimes dry needle for 10 tennis elbow. It's not comfortable, but again, we find in clinic good outcomes. The research is still out on it. We're not sure if it helps or it doesn't, but we know in clinic if it's stubborn and it's really not responding, we throw it in there as an adjunct along with exercises, and that's where we use little acupuncture needles into the muscle group to try and stimulate the body's own healing response. It's not for everyone, but for patients that can tolerate it, it has worked well in the past. And if you find it helped, do let us know. Ollie is just showing you. I don't know if you want to see this, but this is what the needle looks like. Like this. It's a little acupuncture needle, like so. I don't know where the camera is. And then we use that dry needle to try and stimulate some activity on the outside of that elbow. So dry needle, and then we do sort of use that in combination, but our key treatment is always to try and strengthen around that arm. So to recap, what can you do to help your tennis elbow at home? Number one, stop aggravating it if at all possible. Number two, taping and strapping is a possibility, but in conjunction with your exercises. You can use ice in there as well, and then sometimes we do use a little bit of acupuncture. If it's not settling down, please do come in and let us assess it and guide your exercises a little bit more, because sometimes we'll adjust those exercises depending on how much pain the patient's in. But really the outcome for tennis elbow is good. 90% of patients will get better within the 12 months, but you might need a little bit of help with that. Any questions, don't hesitate to drop us a message on Facebook or info@physyoerin.com. We hope you find this helpful. And now it's time for dinner. Homemade chicken curry. Ooh, don't know if you can see that. Ready to go. So that's us. We're off.
Done.